Good morning. I have Omar and Melody over here. They are final year Perio residents at the University of Maryland, which has an incredible program. They're the only specialty program that I know of that actually have microscopes in the clinic. Every Perio resident has their own microscope. Is that correct?
Yeah.
That is correct. Yeah.
Okay, great. So tell me, how does it feel to be in such a unique program? Melody, why don't you tell me?
We feel very fortunate. We know that we're very lucky compared to other residents who don't have the opportunity to work closely with microscopes. So we're very fortunate to have that chance.
Can you tell me, what do you think the advantage is to having that versus the regular Perio program that is out there?
Well, just like with loops, how you have so much more visibility and you can see what you're doing with the microscope. It's even more than that. So it's great to see actually what you're doing, and you get kind of surprised when you see what everything looks like under a microscope versus when you don't use it. So you realize how important it is to have something like that.
Excellent. So Omar, tell me, this is your first AMED meeting for both of you?
Yes.
So can you just tell me briefly about your experience here, what it feels like compared to other meetings, what your experience is personally?
We love it here. We're very thankful to be allowed to participate in such a meeting, and we're certainly just the attendance and the presentations are just of a caliber that you don't see everywhere else. I mean, to look at the microscope, it's a great educational tool. I mean, capturing everything on video, just all that magnification and lighting, certainly you see things differently and you present them differently, which is great for us residents to try to learn from the masters.
Right. So when you go out into practice, which is next year, right? You think you have any advantages over the other Perio residents that are in other programs that are not trained in how to use a surgical microscope?
Well, I think everybody who talks about adopting this technique or this philosophy talks about the very steep learning curve that they have to go through and the long time it takes them to get used to everything. I think we've overcome that by kind of starting from the beginning. So that, I think, gives us a greater edge to everybody else when it comes to just utilizing a microscope and presenting ourselves that way.
Well, thank you guys. I'm so happy to have you here, and hope to have you as members and come back next year. Thank you for having us.
Thank you for having us. Appreciate it.